Good day, fellow learners. This is your mentor, your fact check buddy Ray Gapuz. Once again, joining you for our learning and teaching session for case number 22. And on to our business for today. Before we get to start, I'd like to ask you to join us in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. And to help us achieve this, just watch and finish the ads in our videos. Thank you so much for doing so. And for this year, we have increased the scholarships to 300 slots. We've been successful giving out 100 scholarship grants to our less fortunate brothers and sisters in the healthcare professions from Luzon, Visayas, and Mindanao. So to help us keep the ball rolling, please do not skip the ads. And I'd like to say thank you to our anonymous donor who gave 20,000 pesos for our scholarship program for our fellow nurses. And I'd like to make this public advisory. Dr. Ray Gapuz, that's me, and the mentors of the Ray Gapuz Review System are not part of another review center named Gapuz Review Academy. So if you want our quality programs at the Ray Gapuz System, you have to look for my name, Ray Gapuz Review System. So if you don't see any one of us, the Philippine team of mentors, then that's not a Ray Gapuz System class. I'd like to say congratulations to Ms. Rhea Christine S. Jose for passing the New York Board of Nursing last July 18, 2024. And she processed her application through ITAPS. Now remember this, you get a free review program if you process with ITAPS. And we process your NCLEX application faster and at a more affordable rate because our packages could start for as low as 45,000 pesos. And that includes a free review program with the Ray Gapuz system. So she says, hello, colleagues. I passed my NCLEX at 150 for almost 5 hours last July 18. Thanks to Sir Ray and ITAPS Gapuz and Miss Faith for helping me achieve my dream of becoming a USRN. Always pray and ask for God's guidance. Attend the comprehensive review, 3-day quick fix, and answer the TOP questions 2 to 3 times. And never forget to read from top to bottom the amazing book, NCLEX 311. If you can get the new one, get it. I read the book 2 days before the exam and believe, because I believe you are next. Keep the faith. Congratulations, Miss Rhea. Now on to our next generation NCLEX RN case number 22, and we're going to talk about post-traumatic stress disorder. But before that, let's say congratulations to Miss Aina Tricia Del Rosario from Virgen Milagrosa University Foundation for passing the Texas Board of Nursing last September 10, 2024. And let's find out her success recipe. First of all, thank you, Lord, my family, friends, and babe for helping me reach this milestone. I could not have done it without you. I took my NCLEX Next Generation exam last September 10, 2024. The exam was very intimidating and challenging for me. My computer shut down after 85 questions, but my hat's off to Sir Ray and his team who provided me with all the tools I needed in order to pass the test. I utilized the comprehensive reviews and replays, quick fix sessions, one online and face-to-face. Also watched the replays for mastery. Also took advantage of the course shells, which helped build my stamina in answering questions and thus have a similar approach to the actual test. Let me repeat that. The course shells thus have a similar approach to the actual test. That is why the sense of familiarity while taking the test eases my nerves a bit. The Power Books Nursing Reminder Sheets Pharmacology book gave me a summary of the important details to remember strategically. Sample questions and topics from NCLEX 311 and NCLEX Next Generation. Some of them indeed appeared, helping me boost my fighting spirit while taking the test. Once again, some of them appeared. Wow. Okay. I hope you'll experience it too. Okay. And Sir Ray's YouTube videos like Pecha Kucha and updates were also a great help. I listen to them in my free time. Once again, my heartfelt thanks to Sir Ray, mentor staff, and IT for the dedication and support in helping me realize my dream to pass NCLEX. To God be the glory. That's Aina Tricia Del Rosario, USRN from Virgen Milagrosa University. Now, on to our NCLEX RN alert. Let's talk about post-traumatic stress disorder. So PTSD in short is a psychiatric disorder that occurs in one who either witnessed or experienced a traumatic event. Like, for example, if you had the experience of witnessing a shooting incident during a heavy traffic flow while you are driving, you could experience PTSD. or it could be as simple a situation as big dogs were running after you. That could also be traumatic, and you can experience PTSD. Now, in PTSD, the symptoms would usually appear in 4 to 6 weeks after the incident. So, it may result from experiencing threats on a person's life and well-being. And what are these situations that could potentially lead to PTSD? You have here the code PTSD: pain, traffic collisions, sexual assault, and of course, domestic violence, or this could be associated with a husband or a wife who is a batterer, or a domestic partner who is abusing you either physically, emotionally, or financially. All of this could actually trigger post-traumatic stress disorder. Now, PTSD symptoms reflect physical and emotional reactions like insomnia or difficulty having a sleep at night, getting easily startled, irritability, and even confusion, avoidance, staying away from places that remind the traumatic event. Now, the ability of the client to go back to where the trauma once occurred is a reflection of stage 3 on the road to recovery. We'll talk about that in a while. And intrusive memories, flashbacks, and nightmares that they experience while they are asleep. And then negative changes in thinking and mood, in which anger or numbness could occur. Numbness, which simply means that the client may try to shield themselves from the emotional trauma by simply not reacting to the situation. They become nonchalant to the situation. So PTSD treatment is geared towards enabling the client to gain control of their lives. So at least the symptoms would actually not go away, but at least they're able to control how they react to the symptoms. And that is what is important in PTSD treatment. So the main PTSD treatment is talk therapy. So they have to find a psychotherapist to enable them to facilitate catharsis or the emotional release as they talk about their experiences. Now, PTSD treatment also includes exposure therapy, in which the client is prepared to face the traumatic situation, cognitive therapy, in which they try to convert negative thinking that's trying to hold them back into a positive approach of coping by reflecting and learning from the negative experience, and the use of antidepressants, especially if they develop depression after PTSD. Now, face-to-face support from others is the most important factor in PTSD recovery. That's why support from family, loved ones, partner, the husband, the wife would actually help the patient recover. So exposure treatment for PTSD helps the client face frightening situations and memories. And cognitive therapy for PTSD helps the client identify negative beliefs that keep the client stuck. So remember, exposure treatment helps the client face frightening situations. Cognitive therapy focuses on the thinking process of the client, helping them to identify negative beliefs that keep them stuck and developing coping mechanisms to transform the negative beliefs into a more positive outlook. Okay, now there are 5 stages of PTSD, and these include impact or emergency stage. That's stage 1. In this stage, the client struggles with the experience. PTSD symptoms like flashback, nightmares still manifest. So the priority for the nurse is to ensure safety of the client and stabilize the client. The focus should be on reestablishing a sense of trust, specifically trust on the ability of the client. You have to bring that trust back because they lost it, especially when they are in an abusive relationship. Second stage is the denial or numbing. Now, this is actually numbing. This is actually the attempt of the client to shield themselves from the trauma. So they try to avoid difficult situations, and this is where professional help is needed so that it can help facilitate recovery. Third stage is the rescue stage, in which the client comes to terms with the experience. And an example of the behavior of coming to terms with the experience would be the client goes back to the site where the trauma occurred. This is their way of processing the traumatic experience. And the therapist or the nurse has to be patient during this stage because the client can fluctuate. That simply means we don't expect them to progress immediately to the next phase or to complete recovery, because sometimes they go back and forth to the different stages, from stage 3 to 2, or even from stage 3 to stage 1, the impact or emergency stage. And then short-term recovery involves transitioning to acceptance and having a plan for a sustainable recovery. Now, this is the time in which a client begins to create plans for the future. And that's realized in stage 5, long-term reconstruction, in which integration occurs. The coping mechanisms that are learned from the experience are then solidified and created for the future. So the priority of the nurse here is to connect with others, and therefore their focus would definitely be on enhancing the client's identity, because sometimes they feel that they've lost so much of themselves, and sometimes because of the trauma, they're unable to experience gratification from intimate moments that they spend with their loved ones. And that is very, very important in terms of the long-term recovery of the client. So before we answer a case associated with what we've talked about, let me just highlight the pages of my book, NCLEX RN 311, the Next Generation Quick Fix Edition. And the pages here that I highlighted should be revisited when you're reading the book. And one of those who use it says, complete package ang aking exam. So she's saying that her exam is complete package. Pero dahil sinapuso ko yung 311 book mo, sir, at yung new version ng 311 book, binasa ko araw nga aking exam, kaya ako nakapasa. But because I wholeheartedly read your 311 book, I passed my exam. So that's an ingredient of the learning recipe of a test taker. So I just hope you'll follow through. Now let's move on to case number 22, and let's read through it. After being involved in a road rage incident, so this could be the traumatic incident for the client, a week ago that resulted in a traffic collision of several cars, a 32-year-old male comes to the emergency department for treatment of high blood pressure and palpitations. That indicates anxiety attack or an activation of the autonomic nervous system. Further evaluation reveals insomnia and frequent nightmares. The client undergoes psychotherapy. So there you go. There's a giveaway. You have insomnia and frequent nightmares, which are characteristic symptoms of PTSD. So in the early stage of the interaction between the client and the therapist, which of the following reactions is expected from the client? Is it ambivalence, increased insight, focusing on the future, feeling more confident? Now, the increase in insight, focusing on the future, and feeling more confident, these are all achieved during the reconstruction stage. So in the early stage of PTSD, as we've talked about, sometimes a client may not progress and they can fluctuate from stage 1, the emergency phase or the impact phase, and onto the other phases. So that reflects ambivalence or the development of opposing feelings towards a situation. It's like love and hate coexisting together. A sense of hope or a sense of being defeated could coexist, and that's ambivalence. So the key is be patient if you are the therapist or the psychiatric nurse. So once again, the answer is 1. So may I invite you to join my 10-day challenge, join our Quick Fix Bootcamp in our new home in Baguio, and that's going to be at the Mount Crest Hotel in Baguio City from November 13 to 24, 2024. That's a 10-day high-yield program with me and, of course, the Ray Gapuz mentors. So join our hundreds and thousands of passers from more than 35 countries from around the world who benefited from the Ray Gapuz system. Now, how do we study? We need to study using technology. You have to learn how to navigate technology. And here at the Ray Gapuz system, we pride ourselves because our tools are published by renowned international publishers. And we also have the very effective course shells that contains videos. And the good thing about this is that it's updated every month, unlike other learning management systems that remain static all throughout time. And the third and the most important thing, if you want to do well on your test, you have to be on a conducive environment when you are preparing for your exam. And at Ray Gapuz System, we keep our class comfortable and we have our own next generation NCLEX RN simulation room. So may I invite you to join me in my next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Our fee starts at 3,499 pesos, and it includes live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, your QBank entry books, and engine strategies and sample questions. And of course, you have the opportunity to join me either virtually or face-to-face through the Quick Fix session. It's a 3-day, 24-hour quick fix session that would change the way how you answer NGN. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying till our next video. And for those who are about to take the test, good luck and God bless.